morning, doctors. So today we're going to talk about this Silfrido Chancross patient. Okay, this Silfrido Chancross is a 40-year-old male patient, and he is presenting these following symptoms. He has a patchy hair loss of sudden onset, a symmetrical macular exanthema on his trunk, all over the trunk, and several so-called macular papular lesions with a scaling ring present on palms, and finally a painful radial fissures around his mouth. As we can see, the patchy hair loss of a sudden onset, we note that the alopecia presented a non-inflammatory and non-cicatricial characteristics. And this is a patchy pattern having a moth-eaten appearance. As you can see with the arrows, it is showing you how it looks. The symmetrical macular exanthema on his trunk, as you can see, it's all over the trunk, and it's very reddish. This macular papular lesion with the scaling ring on both palms and soles of the feet. So you must review not only the hands but also the feet completely. The painful radial fissures around his mouth are very characteristic, as you can see with the arrow. And also we can notice this patient has this white lesion on the tongue, and his teeth are really dirty. Okay, thinking about these pictures that you saw, what do you think? What will be your diagnosis? So this is a clinical picture of a secondary syphilis, and you can find this article in this DOI. And this exactly a 4-year-old male patient with the symptoms of secondary syphilis. So what causes syphilis? Well, the cause of this syphilis is the Treponema pallidum bacterium. Usually it spreads from person to person via skin or the mucous membrane through minor cuts or abrasions, which now we're going to call sores. And the most common route of transmission is through contact with the uninfected person's sore during sexual activity. So, if you have a sore, if you have a boyfriend or girlfriend with this sore, please avoid kissing a sore. Okay, it should be suspected in any sexually active patient with genital lesions or rashes. Okay, maybe you know this guy, right? He was very popular between all doctors and nurses. Okay, well, we can stage syphilis because it develops in different stations, and the symptoms will vary with each stage. Okay, as you can see in this picture, we have this primary, secondary, latent, and late or tertiary stage of syphilis, and as you can see, the symptoms will be different in each stage. Well, which are the most common symptoms? The stages can overlap. I mean, the symptoms cannot be in such an order. It occurs the first symptoms at the beginning and then later the others. So you may be infected with syphilis and not notice any symptoms even for years. Maybe you have a sexual intercourse with an unprotected, safe ways, and then later, after a couple of months or even years, then you will have signs and symptoms. But the first thing that we should look for in syphilis is this small painless sore called a chancre. As we can see, mostly it appears on the genital parts of the body, and this chancre usually develops about 3 weeks after exposure. The sore appears at the spot where the bacteria enter to your body, so it can be everywhere. It can be mostly on the genital area, but could be hands, could be the mouth, okay? And even can be in the rectum or the mouth. Chancre is about 31% sensitive because it's usually painless, and it may be hiding within the vagina or rectum, so you will never even notice that you have the lesions because you don't feel any pain, but they will be living inside your rectum or the vagina. Okay, the chancre will heal on its own within the 3 to 6 weeks. Well, this is the primary syphilis. While most people infected with syphilis develop only one chancre, but some people can develop several of them. Okay, so we must review our patient totally so we can find one or even a lot of them. Well, now our patient, secondary syphilis. Okay, within a few weeks of the original chancral healing, when it's becoming like smaller or with no pain, it's healing now, you may experience a rash that begins on your trunk, and eventually it will cover your entire body, even the palms of the hands and the soles of your feet. As we can see, there's like the mouth and the trunk, hands, feet. This rash is usually not itchy. It means you're not going to be like hitching, and be maybe accompanied by wart-like sores in your mouth or genital area that can look like the verrugas, asemejan a las verrugas. Some people can also experience hair loss, like our patient, muscle aches, fever, sore throat, swollen lymph nodes, and these signs and symptoms may disappear within a few weeks or regularly come and go for as long as a year. So it can be a long period of time. Talking about tertiary syphilis, if you aren't treated for syphilis, these signs and symptoms may never return, or the disease may progress to the hidden latent stage known as late tertiary syphilis. The latent stage can last for years, and about 15 to 30 of the percent of people infected with syphilis who do not get treatment will develop this tertiary syphilis complication. In the late stage, the disease may damage your brain, nerves, eyes, heart, blood vessels, liver, bones, and joints, and can be even life-threatening. When we have the secondary syphilis, we can also develop neurological problems because we can have or present headache, even a stroke, meningitis, hearing loss, visual problems including blindness, dementia, loss of pain and temperature sensation, and even in men they can even be the dysfunction like impotence. Also, they could develop bladder incontinence, and it can lead us to neurosyphilis at any stage because the damage can be spread into the brain and all the nervous system, and obviously it can affect the eye, presenting the ocular syphilis, which can make the people to get blind. And it also can cause cardiovascular problems like aneurysm, inflammation of the aorta, and some other blood vessels, and even can damage the heart valves. And well, something that is very, very impacting in the tertiary syphilis are the gumas. What are gumas? Well, these are bumps that can develop on your skin, on the bones, on the liver, or any other organ in the last stage of syphilis. And it's the aesthetic is really very impacting because they look like very, very big. And okay, there's no words to explain this. Okay, there's another part. This syphilis can be transmitted via the mother when we are talking about pregnant women, and this is named the congenital syphilis. In pregnancy and childbirth complications, those babies that are born to women who have syphilis can become infected, even through the placenta or when they are on the delivery labor. Congenital syphilis greatly increases the risk of miscarriage, stillbirth, or your newborn's death within a few days after birth. So it's really, really a big problem. So that's why we always encourage our pregnant women to get tested, because syphilis, as we can see, is a silent killer. So later signs and symptoms may include deafness, teeth deformities, and saddle nose. You remember this nose that looks like a Tia de Montar, where the bridges of the nose collapses. And babies born with syphilis can also be born too early, be born dead, which is called stillborn, or die after birth. That's why we said all pregnant women should be screened for the disease. To confirm the diagnosis of syphilis, we use laboratory tests based on serology. Treponemal test will detect antibody to T pallidum proteins, and non-treponemal tests detect antibodies directed against lipoidal antigens, damaged host cells, and possibly from treponemes. Both tests are used to confirm the infection, and they will determine whether the disease is active or it is not. Early syphilis can be cured with a single shot of benzathine penicillin G. This penicillin it's been like more than 100 years in the world, and it's still very effective against it. Okay, so this is a joke, a Spanish joke, but maybe we try to translate it. So the man to the prostitute after an unprotected sex. What comes up to you, you put or name him George. Literal, le ponemos Jorge al niño. The sarcastic prostitute answers, okay? And to what comes out to you, you put penicillin. Oh my God. Okay, syphilis is contagious during its primary and secondary stages and sometimes in the early late stage. Syphilis can be spread by using the same toilet, bathroom, clothing, or eating utensils, or from dark knobs, swimming pools, or hot tubs. Okay, the transmission will be directly if you have the contact with the sore. When are you going to be in a risk factor situation about syphilis? Well, if you engage in unprotected sex, if you had sex with multiple partners, if you are a man and you have a sex with a man, and if you are infected with HIV, remember is the virus that causes AIDS. In this part with the HIV infection, those adults with sexually transmitted syphilis to other genital ulcers have an estimated 2 to 5-fold increased risk of contracting the HIV. It's because of the source. It means that the sore can bleed very easily, and it gives you an easy way to get the HIV because it enters to the bloodstreams during the sexual activity. I mean, you're not paying attention if it's making it's hurting you, so that's why it's easier to be infected. We have to also think about these other sexually transmitted infections such as gonorrhea, chlamydia, because we should screening these four illnesses. Okay, so what about the prevention? Okay, we must be very preventive persons because the transmission of syphilis is very common. Okay, this prevention must be taken in account that there is no vaccine for syphilis. Therefore, to help prevent the spread of syphilis, we are giving you the next suggestions. Please abstain or be monogamous. Such a difficult thing nowadays, right? Okay, so the only certain way to avoid syphilis is to not have or abstain from sex. What is it? Nopalitos. Okay, exactly. Abstains. Forbidden. The next option is to have mutually monogamous sex in which both people have sex only with each other and neither partner is infected. I mean, it's the only way to be a monogamous. I insist. So difficult nowadays. Okay, the other prevention is if you have are going to have a sexual intercourse with a stranger or many people, well, just use a latex condom. But this condom can reduce the risk of contracting syphilis only if the condoms cover the syphilis source. Other way, that will not work. Okay, so you can use this suit. Okay, also avoid recreational drugs. Why? Because when you take drugs such as cocaine, marijuana, or even alcohol, these drugs can inhibit your judgment and lead to unsafe sexual practices. Okay? O como dice el dicho, cuerpo dormido, por si no lo saben. Okay? And that's why Pórtate mal y cuídate bien, okay? Bueno, the last thing to say is that if we are responsible sexual people, then we should notificate our partners if we have the infection. That will be an ethic stop, but we should. If test shows that you have syphilis, your sex partner, including your current partners, the one that you are living with or having sex with, and any other partners on your past time, like for about 3 months or even 1 year, should be informed so they can get the test and be aware if they are also infected. Because as we said at the beginning, syphilis can last even a year or a long, long time. If they are infected, they can be treated on time and they can avoid getting those tertiary lessons. So thank you, doctors, and please just finish the task that is at the end of the presentation.